Why is it so easy for some women to get pregnant and others struggle to have a baby? Let's talk about it. Infertility can be a long, heartbreaking struggle. The most common cause of female infertility is hormonal imbalance. And it's sad how many patients I've seen over the past 30 years who have spent so much time and money on infertility treatments before addressing their hormonal imbalances. Of course, there can be mechanical issues like blocked fallopian tubes so sperm cannot reach the egg, or congenitally deformed uterus that cannot carry a fetus. A pelvic ultrasound can detect congenital deformity, and a hysterosalpingogram, which is an X-ray test in which a dye is injected through the cervix and into the uterus, can determine the patency of your fallopian tubes. If you've been trying to get pregnant for over 6 months and you have not been able to conceive, then it is time to get a workup. An infertility workup includes for her a full physical exam with a pelvic exam. Blood work. Basic blood work includes complete blood count, a TSA to check your thyroid and a prolactin level, and progesterone drawn in your mid-luteal phase to determine if you're ovulating. An expanded blood panel. I recommend a full endocrine workup plus a metabolic panel to be sure you're as healthy as possible to get pregnant. And for him, semen analysis, because we cannot assume it's female infertility. It might be him. His semen needs to be checked for adequate number of sperm that are normal in appearance and are strong swimmers. It makes no sense to put a woman through major testing and treatment without checking her partner. I recommend a complete physical for him too, to rule out any metabolic or hormonal issues that may be a contributing factor for him. So it's important to get healthy before getting pregnant. I wish every young woman could receive a preconceptual counseling. The healthier she is, the healthier a baby will be. And I'm a huge believer that you must be as healthy as possible before trying to get pregnant. Your hypothalamus will not promote fertility if your thyroid, your adrenals, your glucose metabolism, or your pituitary hormones are out of balance. So it's so important that you're healthy to ensure a healthy pregnancy and a healthy infant. You need to be healthy, drug-free, and toxin-free for at least 3 months before conceiving to ensure the healthiest ova. Plus, the father needs to be healthy, drug-free, and toxin-free for at least 2 months prior to conception for his healthiest sperm. As the hormone queen, I have helped many infertile women conceive. And my goal is to get them as healthy as possible, their guts healthy, their immune system strong, their hormones in harmony, before getting pregnant. Usually within a few months of taking Genesis Gold, most of my infertile patients conceive without infertility treatment. Even those who needed artificial insemination or in vitro fertilization to conceive their first child. And their pregnancies on Genesis Gold are healthier. No gestational diabetes, no hypertension, no excessive weight gain, easier deliveries. Before Genesis Gold was available, I had a patient come in for an infertility consult. After a hysterosalpingogram and a postcoital test, we proceeded with insemination and bioidentical progesterone to support her through her first trimester. She conceived, but with significant weight gain, gestational diabetes, and high blood pressure. Now, after delivery, she did suffer from postpartum depression, and her child has a mild learning disability. When she came back to prepare for her second pregnancy, she asked about alternatives, and I offered her Genesis Gold. She conceived in a couple of months. She used progesterone for a corpus luteal defect to prevent miscarriage. And this time there was no gestational diabetes, no hypertension, no postpartum depression. And her second child is very healthy and well ahead in its developmental milestones. If you're having trouble getting pregnant, please sign up for my free hormone reboot training to learn everything you need on how to get your hormones back in balance. One of my patients with hypopituitary disorder, meaning no periods, low thyroid, low adrenal, no pituitary hormone production, and infertility, needed complete bioidentical hormone replacement therapy. But after a year on Genesis Gold, she wanted to start weaning off her hormones, and we went really slowly over many months until she was having normal periods on her own without using any hormones. She delivered a healthy baby boy at the age of 43. If the woman with no hormones can get back in balance and get pregnant, there is hope for you. I'll see you in the next video.